Dr. Mike Burgess has introduced a bill that would change the formula for how doctors get paid for each service provided under Medicare. He wants to keep doctors performing services for Medicare patients. The Congressman, Mike Burgess, is with us right now. Congressman, welcome to the program. Good to see you, sir.
Good to see you, Stuart.
Now, before you went to Congress, you're a practicing doctor, so you know what you're talking about. And I think you're trying to remedy the situation that emerged in the Wall Street Journal article, where an increasing number of doctors are walking away from Medicare patients. You want to stop them walking away by paying them more money. Okay, I got that, sir, but who pays them this more money? Taxpayers?
Well, the entire formulaic system in Medicare has been wrong for years, and in fact it prices the services that doctors provide under what it costs them to. You can't cover your expenses with what Medicare reimburses. So every year doctors were living under this sword of Damocles, hoping that Congress would fix the so-called doc fix before the end of the year. This bill repeals the SGR formula. It does provide for a period of stable updates. You know, there are ways to do things more efficiently, and that is one of the things that we incorporate into the language of the bill. But honestly, yes, it is going to cost money, and the question is, are you willing to pay the money that you've obligated yourselves to pay when you said we're going to take care of everyone over the age of 65 in this country? I think this bill provides a clear pathway to do it. It allows doctors at least the certainty so they can make plans in their businesses about whether to even stay as a Medicare provider and continue to provide those services. We still got a long ways to go, but this was a big milestone yesterday.
Okay.
We've come farther than we've ever been before.
Yes, sir. Thank you, Doctor. 1 second. I've got the General Accounting Office. It says that young, healthy people, they're going to pay the fine rather than pay for health insurance under Obamacare. Now that means less money in the big pool for the treatment of elderly and chronically sick people. What do you make of that late report?
Well, I think they're accurate. You know, we're not talking about Medicare there. We're talking about Obamacare. But the premiums for the young, healthy individuals, the 28, 29-year-old, are going to dramatically increase. We'll probably see that the middle of September, just before the open enrollment period starts for Obamacare. Next September, it's going to hit with a vengeance. And I think that's where you'll see the national recoil away from Obamacare, because of the cost will now be laid bare, and people will see just what it is they're in for.
Now, I'm sure you still are. Are you a practicing doctor? I know you were a doctor, but you're on the inside. Sorry, go ahead, sir.
I'm licensed but not insured, so if you feel ill, I'll call 911 for you.
I wouldn't want to pay your liability insurance premiums, but you're on the inside of the medical profession. You know what's going on. You're looking at the approach of Obamacare. We see it as the approach of chaos. How about you?
Well, and we all are focused on the coverage costs that are going to go up so dramatically. But right, from the physician's perspective, right now they feel lost at sea. They don't know what this means. No one is talking to them. You can't get a straight answer out of the agency or the administration. So, yeah, it's a time of great turmoil. And as you know, that hardly breeds satisfaction.
If you're uninsured, right? You're a licensed medical doctor, but you're uninsured. Is that correct?
Oh, no, I have a health savings account. And I've had one since 1996.
But you don't have insurance to practice medicine, right?
Oh, well, the liability insurance, right, yeah.
And there's no way you would treat anybody if you don't have liability insurance, would you?
Under some Good Samaritan laws, you get a little protection, but it would be dicey.
I just wish we could have had tort reform as part of health reform, but we didn't. But there you go.
Absolutely.
And I know you're
with me on
this.
Links.
Doctor,
yes, sir.
Thank you very much indeed for joining us. Appreciate it. Good luck with that bill.